Good afternoon and welcome to today's webinar, Medicare 102. My name is Tammy Cave and I am a caregiver specialist with the Caregiver and Supportive Services Unit at Fairfax County Area Agency on Aging. Before I introduce today's speaker, I will give a quick disclaimer and go over a few housekeeping items. The disclaimer is that today's webinar and presentation is not intended for broker or agent education. The presentation slides have not been shared as the content is proprietary and not intended for distribution. If you have questions about Medicare, we encourage you to contact Fairfax County's Virginia Insurance Counseling and Assistance Program, VICAP, directly at 703-324-5851 or at 703-324-5078. If your call is not answered immediately, please leave a message with your name, phone number, and a convenient time to return your call. This number serves as their intake line. Today's presentation is being recorded and a link for the recording will be sent to all registrants a week from today. I would also like you to know that closed captioning has been enabled. At the bottom of your screen, you'll find a Q&A button where you can submit any questions during the presentation. We've set aside a few minutes at the end of the webinar to address as many questions as possible. However, we may not be able to respond to them all. For any unanswered questions, we'll include VICAP contact information in the follow-up email after the webinar. As you sign out, you'll be prompted to complete a brief survey from the Area Agency on Aging. We kindly ask that you take a moment to fill it out as it helps to design programs that are relevant and valuable to our caregiving community. Also, there will be another satisfaction survey that comes out via email from the Administration for Community Living. It's a separate survey. The email includes a link to complete and submit the survey. We encourage you to complete both surveys as they should only take about 5 minutes. And please provide important feedback that supports the development of future programming. Now, it is my pleasure to introduce today's speaker, Patrick Kinlan. Patrick Kinlan is a VICAP volunteer who has been with us for 15 years. He retired in 2011 after having worked in the financial field for 38 years. He counsels Fairfax County Medicare beneficiaries on Medicare cost savings for Medicare Part D and other health insurance options. Besides VICAP, he enjoys volunteering at the Washington Dulles International Airport as a traveler's aid assistant. Patrick, thank you so much for being here. We are looking forward to your presentation today. Please come off mute and take it away.
Okay, Tammy, thank you. This is a seminar about Medicare, and hopefully we'll be able to get to all of your questions as we go along. Next. Okay, the program is the Virginia Insurance Counseling and Assistance Program, VICAP. Next slide. We are sponsored by Fairfax County government, and that is our website. Thank you. Next. Here is our main phone number, 703-324-5851. You can call us anytime. There's an answering machine which will take your information, and we will get back to you as soon as possible. You can also email us if you want. This slide also shows some of the excellent sources of information for you. The first one I'd like to emphasize is Medicare.gov. It's a great place to have most of this information answered for you. Next. Okay, today we're going to focus on the key choices you need to make in deciding to go into a Medicare plan. You have a choice of going into original fee-for-service Medicare, which is Parts A and B, or a Medicare Advantaged plan, MA, Part C plans. Next, you need to know when to get and sign up for Part A, hospitalization, and Part B, doctor services. Then the question is when and if you should get a Medicare Part D separate drug plan. Now, if you choose original Medicare and don't have a good health retirement plan, you may want to consider getting a Medicare supplement plan. We'll talk about this a little bit later. Next. Okay. Basic Medicare, there are 4 parts to Medicare. Part A is hospitalization coverage. Part B is doctor coverage, medical doctor coverage. I'm going to skip over to go to Part D is drug coverage. If you have a separate plan of Part D, you would have separate drug coverage. Medicare Part C are these newer Medicare Advantage plans. As you can see from the logos, it covers hospitalization, doctors, and usually drugs. Next. Okay, where is the Medicare supplement as part of that chart? Well, there is no separate chart because they're not part of the government plan. These are policies sold by private, generally for-profit insurance companies, and they fill in the gaps of your coverage of Part A and Part B. But Medigap does not cover your drugs. That's a separate Part D plan that we'll again talk about in a little while. There are some strong consumer protection laws on these plans. And later we'll talk about being very careful in selecting Medigap policies in the future. Next. Okay, so just to repeat, original Medicare is the Medicare program administered directly through the federal government. Medicare Advantage plans have the same benefits, basically, but are offered by private insurance plans, insurance companies, and are regulated by the federal government. Next. Okay, Part A is hospitalization coverage. You're eligible to get Part A at age 65. Most of you are going to get it for free because you or your spouse have already worked for at least 10 years and have paid Social Security taxes all along. So those taxes are going to cover your Part A premiums after you're eligible at age 65. If you haven't worked for 40 quarters, you might have to pay a premium, and you can talk to us separately about those situations. But you would get coverage, and if you're a deceased spouse, you would be able to get coverage based on the fact that your spouse had coverage during his lifetime. Part A covers inpatient hospital stays. It covers skilled nursing facility care after a 3-day hospital admission and covers hospice as well. So it's a great benefit because now there is one caveat that when you go in the hospital the first time, there is a first day deductible, and that's at least $1,716. And after you're there for 60 days, there might be an additional deductible charge. Next. Okay, Part B are doctor medical coverages. So this is optional and voluntary, but in 2025, all of us pay a premium for Part B. It's now $185. It's apparently going up to about $206 in 2026. We haven't seen the actual final number yet because of the shutdown in the government, but that should be coming out very shortly. But everybody pays this base premium of $206 or so a month. Okay. If you don't sign up for Part B when you're first eligible, you may face a late enrollment penalty. Now, We're also going to talk about the fact that if you're actively working past 65 and you have health insurance, you don't have to sign up for Part B. You would not be facing a penalty to then sign up for Part B later on. Part B covers 80% of most doctor bills, outpatient surgery, wheelchairs, durable medical equipment, etc., and some other drugs that are administered outside of a doctor's office. Next. Okay. Sometimes this question comes up. Do all doctors take Medicare? Well, in our area, almost everybody takes Medicare. If you don't have Medicare coverage, you would know that when you sign up with a doctor, and then you would be liable for the 100% of the cost of that coverage. But most doctors do cover Medicare. Some have a slight change to it and are non-participating doctors, and you might have to pay a little bit more to see a non-participating doctor. But most doctors do cover Medicare, so you don't have to worry about it. But if a doctor doesn't take any Medicare coverage, you would have to pay 100% of the bill. But very, very few doctors opt out, less than 1%. So you probably are going to have good doctor coverage. Next. Okay, Part D. Whoops. Back one. Can you go back one, Tammy? Okay, well, if not, we'll just start with this one. So, oh, there we go. Oops. Next, all right, 11. Does 11 come up? Part D? Okay. Okay. Part D is a drug program. And to find out which plan you want to go into, you can shop on Medicare.gov for all the different drug plans that are available here in Virginia. The premiums on these plans range from zero monthly premium to as much as $134 if you're taking very, very expensive drugs. Keep in mind, you should not shop for your Part D plans based on premiums or deductibles alone. You need to find out which drugs you're taking, enter that on the website, because then you'll know what that plan pays for each of your individual medications. Another thing to keep in mind is that every year during open enrollment, which is October 15th through December 7th, you should check to see if your plan has made any changes. Their premiums may be going up next year. The drugs that they've covered at a certain rate this year are a different rate next year. So you should look and check your plan to see if you want to stay with that plan or you want to change to a new plan, which you can do once a year in during the October 15th through December 7th timeframe with no questions asked. And then on January 1, you would be in a new plan for the following year. Now, keep in mind again that Medigap does not cover Part D copays and deductibles. So if you're in a Medigap plan, you have to add a Part D plan. Next. Okay. The Part D drug benefit is that the basic benefit in all these plans may have a deductible as high as $615 a year. But keep in mind that most of the plans cover low-cost generic drugs without you having to pay the deductible. Medicare Part D pays 25 that you pay in Medicare Part B, you pay about 25% of the cost of the drugs, but it assumes that all your drugs that you have listed are on your plan's formulary. If they're not on the formulary, then there is no drug coverage on that drug, and you'll have to pay the full cost of that drug. Keep in mind that there's a new plan in 2026 where once you've spent $2,100 out of your pocket on covered drugs, drugs that are on their formularies. You don't have to pay anything further for the rest of the year. So that's a great new plan that the government is implementing. Next. Okay, again, let's go back to Part C, Medicare Advantage plans. They cover A, hospitalization, B, your doctors, and most of them cover drugs. So if you're signing up for an Advantage plan and you need drugs, you would want to make sure that that plan covers drugs. Okay, now, all Medicare Advantage plans have restrictive networks of doctors and hospitals, different copays and deductibles, and have certain limits on what's covered. So you need to be careful to make sure that, like, if you have a favorite doctor today, you would call an Advantage plan that you're thinking of going into and say, does Dr. Jones take Medicare Advantage XYZ plan, to make sure that they're going to cover you if you go to that doctor. If you don't go to that doctor, then you could be liable for 100% of the cost of that doctor. Next. Okay. How does all this work? Well, there are different Medicare Advantage plans. Some are HMOs, some are PPOs, some have 0 monthly premium, some have higher monthly premiums, but you always have to pay your Part B premium, and then your other costs are covered depending on the plan that you choose. Next. Okay. What does an MA plan do for you? Well, you get the same benefits as in original Medicare. You always still have to pay your Part B premium. Now, your cost sharing may be different. So if you're in a Medicare Advantage plan, you might have to pay $10 to see a primary care physician and $50 to see a specialist. Some would have no charge to see a primary care physician. So they're all different. So you need to, again, check with the individual plan to see what your coverage is going to be. Now, another big benefit of these MA plans is that you then get catastrophic protection, an annual limit on the total out-of-pocket costs that you might be faced in a given year. Okay. So that's a nice benefit. You don't have that protection if you're in basic Medicare. Okay, you generally must use the hospitals and doctors that are in your network. It's important to keep that in mind. And if you go outside that network, you may not have any coverage if you're in an HMO Medicare Advantage plan. You may have some coverage if you're in a Medicare Advantage PPO plan. If you're in an MA plan, you cannot buy a Medigap policy, but you don't need one, so you wouldn't want to buy one. Okay. Most of them do include drug coverage. Most of them also have an extra benefit, such as some vision, hearing, or dental coverage. We'll talk about that in a minute. Next. Okay, so in an MA plan, they offer extra benefits that are not covered by original Medicare, such things as hearing aids, dental services, etc. And some plans also provide other services, helping you pay some over-the-counter items, okay? These benefits are new, and be careful that some of the TV ads seem to exaggerate the extent of these benefits. So you need to ask, is there a dollar or quantity limit? For example, if you have a dental coverage plan, what do they pay? Do they just pay for your annual dental exam, or do they cover some cost of crowns and implants? But some have a limit as to how much they will pay for each of those services. And then another hard question is, do you need a doctor's order in order to get extra coverage? And then finally, what are the copays for each of the individual components? Next. Okay, this is just a general chart showing the difference between original Medicare, which covers hospitals, covers your doctors, And then with a separate Part D drug plan, you would have drug coverage. If you're in Medicare Advantage, it covers all the same things. And then you would want to make sure it covers your drugs as well. Okay, next. Okay, how can they offer more with just a $0 premium? And the reason is that the government steps in and helps the Medicare Advantage plans, because for each Medicare Advantage plan participant, those plans pay the government a certain amount of money. And so the government turns around and enables the plans to offer more services. And the reason that they can do that is because the Medicare Advantage plans generally negotiate better deals with doctors. They help manage things like diabetes. They make sure you're vaccinated. The bad savings are that there are not often enough specialists in a given network to cover you. You may have to wait for services because they don't have as many doctors available. You may have to get prior authorization, and sometimes you're denied coverage, which you can appeal, but there are some things to keep in mind. So your job is to pick a good plan, and you do that by going to the Medicare.gov Plan Finder website and look for plans that have the highest quality star ratings. Next. Okay, how do you shop for Medigap? So here, you need to go on Medicare.gov and search for a plan. Now, another excellent way to do this is to go to the Virginia Insurance Department website, which is listed here, scc.virginia.gov/Medigap, because they will help you choose a Medigap plan. Now, keep in mind that premiums start at about $125 a month, over and above what you're paying for Part B, and that's at age 65. For older people, and just to keep in mind, if you start at age 65, your premium's going to go up every year because you're a year older now. And so the premiums vary widely. So you need to make sure you're choosing one with the best rate for you. Next. Now, again, the common confusion is that Medicare Advantage plans are not Medigap plans. You can't have both. And if you're thinking of a certain type of coverage, you might want to make sure that that coverage is being provided by your Advantage plan. Otherwise, you would go on to a Medigap plan. So they're totally different. And just be aware that sometimes people sign up for one thinking they've gotten the other, or vice versa. So keep that in mind. Next. Okay, for folks in the group here that have lower income, so if your income is less than $23,400 or $31,700 for a couple, and you don't have a lot of other money sitting around, there is help with Medicare's premiums and other costs. There are Medicaid programs and other state-run programs. So talk to us afterwards. And just keep in mind that the lower your income, the more help you can get. But if you're above the thresholds, you're not going to get any extra help from anybody other than out of your own savings. Okay, next. One other thing to keep in mind is that there is something called IRMAA, IRMAA. And it's a program that if you're among the better off citizens of our country, making more than $106,000 a year or $212,000 for joint tax returns, you're going to be hit with extra charges for your Part B and your Part D premiums. Okay, they determine this based on looking at your income tax from 2 years ago. So if you were working up to age 65 and you made a lot of money when you were age 64, you're probably going to be hit with this penalty. Now, this penalty is adjusted every year based on your income. So if you are retiring and your income is going down next year, you can request that your premium be lowered. And all of these numbers are adjusted each year for inflation. But it's important to keep this in mind. And the next slide, I think, shows, next, Tammy. Okay, no, sorry, not the next slide, but just want to make sure we emphasize that original Medicare does not help with dental, hearing aids, or hearing exams, or normal eye care, like your annual eye exam, okay? But Part B basic Medicare does cover such items as cataract surgery and other medically related eye issues. Now, you can buy private coverage for those areas if you want, but keep in mind that they also have limits as to how much coverage they're providing. And sometimes you have to go to a doctor that's in their individual dental network. Most Medicare Advantage plans do cover these services, but again, there are restrictions. The biggest omission with Medicare is it does not cover custodial, non-skilled nursing home care, assisted living care, or memory care. So you have to budget for those items if you are expecting to be exposed to those costs. Next. Okay. Whenever you start Medicare, you face a big decision. Should you go with original Medicare or should you go with Medicare Advantage? In original Medicare, you will enroll in Part A, and if you don't have good retirement insurance, you want to enroll in Parts B and D. If you don't have good retirement insurance, you want to add a Medigap policy to cover the gaps that Part B doesn't cover. In a Medicare Advantage plan, you still have to enroll in Parts A and B. It usually includes Part D, so you won't have to sign up for a separate Part D drug plan. But again, keep in mind you cannot buy a Medigap policy if you're in Medicare Advantage. Next. Okay, some of the pros to consider whether you want to go with original Medicare or Medicare Advantage. If you want to go to original Medicare, you can go to any doctor in the country that takes Medicare. So it's easy to travel and find doctors in another part of the country. You can see the best doctors in the country. You don't have to skimp on whether you want to go to a doctor or not. And if you're in a good Medigap policy, you probably have lower out-of-pocket costs than if you're in a Medicare Advantage plan. But again, keep in mind, you got to pay for that Medigap policy. If you're in Medicare Advantage, the nice thing is that there's only one plan that covers all your doctors. It discourages overuse. It may some extra benefits such as hearing, dental, even gym memberships. But again, you would need to check with the individual plan to see what they're covering. Care coordination can be better so that you don't have two different doctors, because in Medicare, basic Medicare, you might be seeing several doctors that don't know each other. Whereas if you're in an Advantage, they will know where you're going. And you have potentially lower total premium costs, okay? And a limit on your total out-of-pocket expenses. So that's a real plus in a Medicare Advantage system. Next. Okay, some of the cons to consider. If you're in original Medicare, it could be more expensive, especially if you're buying a Medigap policy. The care may not be coordinated, and you have to do some shopping to make sure you're getting the best coverage. In a Medicare Advantage plan, again, you have a limit on your choice of providers. Some of your regular doctors may not be in the network. You would need to find out if they are before you sign up. And if you want to go to the Mayo Clinic is usually not covered by any of the Advantage plans. And the reason for that is it's outside of coverage in this area of the country. So the Medicare Advantage plans are generally regional in scope. And so it can be complicated to negotiate the rules with regard to this. And a lot of the plans require prior authorization. So you would have to go to a primary care doctor who would then have to refer you to a specialist. Whereas in original Medicare, you could just go to a specialist off the bat. Next. Okay, some further cons in Medicare Advantage plans. So you don't have the right to buy a Medigap policy with no medical underwriting. So if you're in an Advantage plan for a couple of years and you want to go back and get a Medigap plan, you would probably have to fill out a health questionnaire. And if you have health issues, either you would have to pay higher premiums, you may have a waiting period, or they may not take you at all. They don't have to take you. So you need to shop each year because your current Advantage plans can change from year to year. As a matter of fact, a lot of you are probably facing the fact that I think it's Aetna has canceled going forward some of their Advantage plans. So you would have to get a different Advantage plan going forward. And some networks are changed because some doctors and some hospitals may opt out of their coverage, out of their regional coverage. Next. Okay, if you do choose to go the Medicare Advantage plan, I would suggest picking a plan that covers drugs, and most importantly, your individual drugs. Check to make sure your doctor is in that network. So call the doctor and say, do you take XYZ Medicare Advantage plan? And then you will know whether the doctor is going to be covered. Consider the fact that you may require prior authorizations to proceed with something, and that may take some time. Okay. Find plans with better quality ratings, 3.5 stars or better, and understand what these extra benefits are. And as we say, beware of the hype, know exactly what's being covered. And then you can consider the issue of certain nonprofit versus for-profit plans. Most of the plans are for-profit because they're trying to make a buck. Next. Okay, here's a couple of scenarios. Let's say you're turning 65 and you've already retired, or you have no health insurance. Okay, you would want to enroll in Part B in the initial period time frame. 3 months before your birthday, the month of your birthday, 3 months after. Then you consider whether you want to enroll right away in a Part D drug plan if you don't have any other coverage. Okay, coverage will start the month you turn 65 or the month after you sign up if you delay past your birthday. If you don't sign up when you're first eligible, you may face a lifetime enrollment penalty, okay? 10% increase for each 12 months you delay after age 65 and have no other coverage. Now, if you have other coverage, I'm going to talk about that in a minute. Okay, next. Okay, let's say you turn 65 already, but either you or your spouse are actively working and have a company with more than 20 employees, and through your job, you have good insurance that you currently like. So you don't need to go into Part B because you've got all the coverage that Part B would provide. So you're not subject to a penalty if you stay with your existing plan, okay? But then you would need to join Part B later on after you stop working, after you have stopped active employment insurance to avoid the penalty. So note you only have 2 months to join a Part D drug plan once you start Part B. Next. Okay, scenario 3. If you happen to work for the federal government and your employer provides health insurance to you, and the federal employee plans don't require you to get Part B. Now, you can enroll in Part B if you want, okay? But if you have a really good federal plan, you don't need to join Part B. If you don't join Part B, you could save a lot of money. But if you're worried that your current plan doesn't cover everything that Part B might cover, you might want to join Part B. But then keep in mind, a lot of retired feds have big incomes, and you would be subject to that IRMA additional charge. There's a great book to read if you want to find out more about federal employee plans. Next. Okay, so you need to talk to your HR department if you're currently working, especially if you work for a company with fewer than 20 employees, because some of them require you to get Medicare. You have to join Medicare. The other thing to keep in mind, if you have a health savings account that you're contributing toward, you should stop that additional premium at least 1 month before starting Medicare, or you may be subject to having to pay additional income tax on that benefit. So, and talk to us afterwards if you have COBRA insurance, because there are different situations if you have COBRA. So just be careful if you have any one of those situations. Next. Okay. What happens if you don't start Medicare on time? If you don't start when you're first eligible, or when you stop working after you've had coverage, you can still enroll, but there are limits, and you have to enroll during certain time frames. Okay. So let's say you work past 65, you're 68, you stop working, and you don't have coverage right now. Well, then after a period you don't have coverage, then you want to join Part B. Well, there's only a certain time of the year you can do that, January 1st through March 31st. And then it would be effective the month after you sign up. And you still may be subject to late enrollment penalties because you didn't sign up when you could have. Next. Okay. Part D, if you don't have what's called credible drug coverage, almost everybody has credible drug coverage. You can find that out by going to your HR department. But if you don't, then you need to enroll in a Part D plan. So look at Medicare Advantage. Remember, most of them do cover drugs, so you don't have to worry about whether or not you have credible coverage. If you want to join Original Medicare, you need to join in the 7-month period after turning 65 and not having other good coverage. And every month you delay adds about 1% premium for the rest of your life. So again, if all these things come down to just knowing when to join, and when you want to have full coverage, just join everything right away. Next. Okay, how do you select a drug plan? The best way to do this is go onto Medicare.gov's drug plan finder website and enter your drugs, put in your drugs, and then put in several pharmacies that you want to use. You can go to any pharmacy in the country, but if you put in certain pharmacies, you're going to get better pricing. And then look for the higher star ratings in the drug plans. If you take no drugs or just cheap generic drugs, join a plan with no premium, because you're going to get the cheap generic drugs for a very low cost, and you avoid any penalties. So, and then you can switch plans every year if all of a sudden you need to start taking drugs that are expensive. Then look for a plan that has best pricing for the following year. Next. Okay, if you go on Medicare.gov, this is what you're going to find. And then look at the lower part under the man's waist where it says Find Health and Drug Plans. So if you click on that, and then the next question is going to say, are you looking for an Advantage plan? Or are you looking for a Medigap plan? Or are you looking for a drug plan? So if you're looking for a drug plan, click on the drug plan. And then it's going to ask you to put in your zip code and your address, that's your address, your zip code. And it's going to ask you to enter the drugs that you take so that it can then find the cheapest plan that covers the drugs that you're currently taking. And then it's going to come up with a list of the total cost of those individual plans, starting with the least expensive, going through the more expensive plans. And then check one of the individual plans for more details about how they cover each of the drugs that you've listed, and to make sure that the drug is on their formulary, because then you'll get a better price. And then if you want to enroll, there's a button on the top right. You can enroll right there on the website. Okay, next. Okay, so you can enroll online, call Medicare, shop your plan every year to see if you need to switch plans, because a lot of us could save a lot of money by switching plans every year. And you can do that between October 15th and December 7th. So we're in the time to do that right now. Pick a better plan for next year, and it will start January 1st, and it will automatically cancel you out of your current plan if you've changed plans. But I would also keep in mind that the plan you're in now may not be the best plan to stay with for next year, because your plan may have changed its coverage. And keep in mind that Medigap does not cover Part D. Next plan. Okay. Medicare supplement policies. So again, if you don't have a good plan, shop for a plan. Keep in mind that the costs of these can be high, but also keep in mind that when you search for Medigap plans, there are a lot of different plans, starting with A, running through N. And you'll see a chart which shows exactly how much, what area each of those plans cover. But most people pick Plan G, but some have cheaper premiums. Okay. Every year, the cost of your Medigap plan goes up, as we mentioned earlier. But the nice thing about most of these plans is that they cover your Part A hospital deductible, whereas that deductible will be charged if you're in an MA plan. Next. Here's the chart that I was talking about. And you can see under the G, it covers everything except the Part B deductible, which nobody covers other than Plan F. And you can't get Plan Fs anymore because they're not available anymore. So you would have to pay the Part B deductible if you're in a G plan and have Medigap. That is about $285 right now. So you pay the first $285 of cost, but then after that, your combination of having Part B Medicare coverage and Plan G Medigap coverage, they would pay 100% of all of your costs going forward. Whereas if you're in an Advantage plan, they have their own deductibles and they have copays as you go to each of your individual doctors. Next. Okay. It's easy to shop for Medigap, as I mentioned earlier. Go to scc.virginia.gov/Medigap, enter your age, gender, location, and which plan you want to pick, like Plan G, and it will then list all of the people that offer Plan G. Keep in mind that every Plan G is exactly the same coverage. It doesn't make any difference whether you go with Bankers Life, AARP, Aetna, Humana. They all give you the exact same coverage. So the only difference is price. So you want to basically here shop for price. And then once you see one that you like, call that company up and confirm that the price you looked at is exactly what you would be expected to pay. And then you can enroll directly with any one of those companies that you pick. Next. Here's what happens if you do that search. It will come up with a list of plans that are available. Click on down the bottom, click on G, and then I think the next page, if you did that, next, will show you here are all the G plans that you've picked, showing that the least expensive one is Bankers Fidelity, a cost of $1,500 a year. This is if you're starting out as your age 65. And so that's about $125 a month. And you can see that they go up depending on which, and this is just the A's, A, B, C, D. And there are lots of plans that you can choose from, and it will just show you what their individual costs are. Next. Okay, now there's one other thing. I'm only going to stop here briefly, but to say that there's a new birthday rule for Medigap, which says that if you're in a Medigap plan and you don't like the price this year, you have a one-time option starting with the date of your birthday for the next 60 days to change your Medigap plan. I think I mentioned earlier, it's generally difficult to change your Medigap plan. But if you want to change your Medigap plan, you could take advantage of this birthday rule, and we could talk to you further about this. You would have to stay with the same plan. If you're in a Plan G plan, you could change to a cheaper Plan G plan if you can find one that's cheaper. And remember that that Plan G is going to be exactly the same as the coverage you currently have. So it's a great opportunity to search for a lower priced plan. Next. Okay, the last point is keep in mind, there's a lot of fraud out there. Be careful about what you read. Be careful about the things you get in the mail. Just keep everything in mind and make sure you're talking to Medicare.gov and not some fly-by-night company. Next. Okay, here's our contact information again. Call us anytime. We love to talk to you. So keep us in mind. Give us a call. Next.
So I think that's our last slide. We're going to go ahead and take some questions. We did receive some questions by email. And we also have some in our Q&A box at the bottom of the screen. But one of the questions that we received is what are some common mistakes people make when enrolling in Medicare?
Okay, so Tammy, I would say the biggest mistake is not getting enough information and making sure that the plan that you're thinking of going into is covering everything that you want from that plan. And make sure you sign up on time. That's the biggest mistake I think that people make is not signing up on time.
And then is it advisable to delay Medicare enrollment if an individual still has health coverage through their employer?
Yes, if you have good coverage from your current employer and you're still working, there's no need to go into Medicare until you stop working. And so if you have a good health plan now and it's only costing you, say, $50 or $100 a month, you can save a lot of money by not starting into Medicare right away. So I encourage people, if they like their current coverage, stay with their current coverage.
Okay, and then another question that came in is, can VICAP assist individuals who also have other forms of insurance, such as TRICARE for active duty service members, their families, and National Guard or Reserve members?
Yes, and TRICARE is the best health plan in the world. So if you have TRICARE, I would not change your TRICARE plan, but you need to let Medicare know that you have TRICARE. That's the only thing you have to do. But boy, I would not change your TRICARE plan for $1 million.
Okay, and then another question that came in is, how does supplemental insurance work? Is that only if you have an employee retirement insurance plan, or can it be added to original Medicare? And then what is the difference between the supplemental and Medicare Advantage?
Okay, well, we talked a lot about the difference between having a Medigap plan and a supplemental, excuse me, and a Medicare Advantage plan. If you want to add Medigap, which covers, will give you, in essence, 100% medical coverage, it's a good idea to add Medigap to your current coverage. Your other option is to go into a Medicare Advantage plan, but you can't have both Medigap supplemental and Medicare Advantage. So you need to make a choice between the two plans. And again, we can help people decide that, but it's generally just a preference to, if you want a Medigap plan, people who choose Medigap generally like the fact they can go to their own doctors at any time versus Advantage plans. You have to be careful of the network that you're selecting.
Okay, And then another question was, when you do sign up for Medicare, does your current insurance automatically end? That meaning the payments, or do you need to contact the company?
Well, if I were working and I decided that I want to join Medicare, I would let my employer know that I'm now going on to Medicare. So stop charging me for my current health plan because I'm going to start paying for Medicare. Yeah, so you would want to let somebody know that one is ending and one is starting. Medicare always starts on the first of the month. So just keep that in mind. So if you have health insurance through the end of September, then you would start Medicare on October 1, and let them know, let your current plan know, hey, stop taking money out of my bank account on November 1.
Okay, and then another question. My husband is disabled and has standard Medicare plus Medigap now. How can he make the transition when he turns 65, especially on Medigap choices?
So he has Medigap now, and he has Medicare now.
Standard Medicare plus Medigap, and he's disabled,
It is
and
safe.
then wants to know how to do
He would
the
just stay.
the
So-
You
transition.
will have more options. Right
Oh.
now, we only have a option. When 65 clock resets, and he will get more options.
Well, when he turns 65, but he has Medicare A. Oh, he just has Medicare A now, probably.
Has standard Medicare plus Medigap now as a disabled
So
individual.
right now, he only have Medigap A.
Oh, right. Right now, he probably only has Medicare A.
Medigap Plan B. Because it's only one.
Oh, I'm sorry. I got it now. Okay, I didn't understand. If he is disabled and under age 65, he's on a special Medigap plan. When he turns 65, he would have much better options to change his Medigap plan, which is going to save him a lot of money to change his plan.
In 6 months.
Yeah, you have 6 months to change your plan, but he should definitely look for a different Medigap plan, because if you're disabled, there's only one Medigap plan, Plan A, that you're available for. Whereas now he's got the whole array of plans once he turns 65.
Okay, great.
So and if he needs any help, call us on that one.
Okay, and just so that everyone is aware, the VICAP team is all around just to be able to add some comments in. So another question is the birthday rule only for Virginia?
Yes, the birthday rule is state by state. Virginia didn't have it until now, whereas some of the states had it up until now, but now it's available in Virginia. And it's only available in certain states. So if you live in a different state, you ought to make sure that you can affect the birthday rule.
Okay. And then I understand the information on the Medicare side site is not accurate for prices when shopping for a drug plan. Is that accurate? Is that correct?
No, I don't think that's true. I think if you're on the official Medicare.gov website, those prices are pretty darn accurate. If they're not, then the state or somebody is going to be looking at those prices on a regular basis. But those should be very good prices.
Okay. And then I just want to mention to our attendees that we have a significant amount of questions. So we may not get to all of the questions. So please call the telephone number that's on the screen. And then the email address is also provided for you as well. But we will take a few more questions. If on SSD, as in David, do you need to enroll in Medicare at age 65?
SSDI.
You're on SSDI now?
Well, it says SSD, maybe they mean SSDI. Do you need to enroll in Medicare at 65?
Yes. Right.
It depends if he on SSDI 24 months, how much
Oh,
that will get.
So if you're on SSDI for 24 months or longer, you're going to be automatically enrolled in Medicare. So it sounds like the person may have SSDI, maybe has just gotten it, and they don't know what to do. But if they've had it since let's say they're 45 and they get SSDI, after 24 months, they're going to be automatically put into Medicare. So they have the advantage of being in the Medicare system right away. They don't have to wait to be age 65. So they'll be automatically enrolled in Medicare, and then they make all the other choices as if they're starting Medicare.
Okay. And then there's a question that asks, does being a member of AARP have an effect on the Medigap policy? I mean, do you join as a member versus as an individual?
Well, I think anybody can join. Anybody can join. Okay. I think AARP likes to give the impression you need to be a member of AARP, but you don't have to worry about that. Just go ahead and try and join one up. And if necessary, I think it's only $25 to join, and you don't have to ever worry about paying it every year.
Okay. And then if you had a Medigap policy, then switch to Medicare Advantage, can you go back to original Medicare and the supplemental?
Yes. we will need to have it.
So somebody had
Medigap policy
somebody had Medigap
and
today.
then switch to
Advantage.
Medicare Advantage. Can
Yeah,
you go back to original Medicare and a supplemental?
You can switch. It's easy to go from Medigap to Advantage at any point in time. Okay. But it's very difficult if you stay in a new Advantage plan for longer than 12 months, and then you want to go back to your Medigap plan. They're probably going to send you a health questionnaire because they don't like to take people that have extra health issues in Medigap. So that's the real catch there. If you switch into Medicare Advantage and you stay in there for a couple of years and then want to go back to Medigap, you may be subject to a health questionnaire, and they don't have to take you if they don't want you. They don't like you for any reason. They don't have to take you. Okay. They probably would take you, but you may have to pay a higher premium than you would have had if you had stayed with them all along.
Okay, and then we're gonna, we have one more question that we can take because we are at the end of our presentation. The time, we just have so many questions. But the last question is, can I sign up for Medicare, but then delay using it until I stop working?
Well, I don't understand why you would want to sign up if you're still working and have current coverage.
Hmm.
If you are working and don't have coverage, then if you sign up for Medicare, you're going to start being billed for Medicare. So then if you're being billed, why wouldn't I use my Medicare to pay for my health insurance? But again, if you have current health insurance, let's say you didn't realize and you signed up for Medicare and then you still have health insurance and you realize, oh, I shouldn't have signed up for Medicare. You can then request stopping your Medicare premium and coverage. So you can suspend Medicare so you don't have to keep paying the premium, stay with your current health plan, and then just worry about going back on Medicare when you stop working. Does that make sense? You see what I'm saying? Yeah.
Mhm. Okay, well, thank you so much. We are at the end of this program, and what an honor it has been for you to help us today, Patrick. The presentation has been very informative and helpful to those who are struggling to understand the Medicare process and the Medicare enrollment process. To our audience, we want to thank you so much for taking the time out of your busy schedules We appreciate your time and your commitment to learning and growing. As you sign out, we would like to remind you about the 2 surveys we have shared with you. Please take a moment to answer those questions and let us know what you thought of today's presentation. Your feedback on today's presentation is invaluable and helps us tailor future topics for the future. Our next webinar will be next Wednesday, November 19th at noon. Again, that's November 19th at noon on caregiver burnout. Please join Deborah Ross, a licensed professional counselor and certified journal therapist, for an accessible and engaging exploration of what occurs in the brain during burnout. This session will also introduce practice strategies and evidence-informed practices that extend beyond traditional self-care approaches. We have come to the end of this webinar. We thank you for being here, and we hope you have a good afternoon. Have a good day.
Thank you.
Thank you.
Thank you for listening.
You're welcome. Have a good day. Bye.
Okay.